Hello, my name is Amber Blake, and I'm a nursing student at Lock Haven University. Today I'm going to be talking about the information system of the transfusion administration record, also known as the TAR, and how that prevents errors in blood product administration, and why that's important. So, mistransfusion of blood or blood components is the most important error, which can lead to morbidity or mortality. And preventable wrong blood into patient incidents are nearly always caused by human error and may cause fatal reactions due to ABO incompatibility. So that's why this information systems is so important, because it helps catch the human error part of it. The identity check between the patient and the blood component is the crucial final opportunity to avoid potentially fatal mistransfusion. And we use the TAR the most at the end when we're getting ready to administer the blood product. And data from the UK Serious Hazard Transfusion show that around 1 in 13,000 blood units are administered to the wrong patient with occasional fatal outcomes, and were nearly always caused by human error. So again, that's why it's so important that we have this information systems to stop those errors. So what is the TAR? The Transfusion Administration Record is part of the electronic health record and has to do with the transfusion of any blood products. This is where we would scan and document with a second RN that we are giving the blood to the patient, as well as double checking for the last time the label on the blood with the wristband and the doctor's order. The TAR also has a barcoding system in which we must scan the patient's wristband and then the bag of blood product. So that's one of the ways that this information system stops human error, because it will not let you progress if you have not scanned the correct patient and the correct blood bag and it does not match the doctor's order. The the policy and procedure for blood product administration can be found in the TAR at my particular hospital, which allows for easy access for the administrating nurses. So before you do any procedure, you always want to check the policy and procedure manual, and mine just happens to be right in the TAR at my hospital I work at, so that makes it very nice for us, and we can always reference it very quickly if we need to. The TAR is also where we chart our vitals before, during, and after the transfusion, so they can be easily compared. It also prompts a nurse when these should be taken. So if you've ever given blood products, you know that vital signs are very, very important, and the time that you do them is very important, because it can give you a clue if there's going to be a transfusion reaction. At my particular hospital, the TAR also gives us a list of specific transfusion reactions, as well as their signs and symptoms to watch out for and how to respond to them. So that helps us with quick identification of the transfusion reactions, and it also helps us to know exactly what we should do in that situation. So for barcoding, the barcoding system is where the nurse scans the patient's wristband into the TAR, and then the nurse scans the blood bag. The TAR will not let the nurse progress without this, not matching the doctor's order, or matching each other for that matter. So the wristband barcode medication scanning noticeably reduces medication and blood product administration errors of hospitalization and additional costs. So it's very important, because these do reduce the errors significantly. And, the simple intervention in the form of a barrier warning label on the blood bags reminding staff to check the patient wristbands failed to improve bedside transfusion practice. So something as simple as us just checking, we were still having a lot of problems with human error. So the barcoding was actually a much better way for us to go. So it also ensures that two RNs are administering this product. And at my particular hospital, both RNs must check the doctor's order, the blood product bag, the patient's wristband in order to administer the blood product, and to make sure that this is happening and it's not just, oh, I was too busy to double check. We must both enter our secret PIN that's also used in our MAR, to put it into the TAR in order to sign off that this was done. This is like our electronic signature. The RN must also manually type in the information on the blood product bag and the patient's wristband before signing to make sure they are actually compared to two before electronically signing. So we have to look at the codes, and the ABO and the patient's name and everything, and we have to type in all this information to make sure it matches. And it's very important to make sure you're not just looking at the blood bag and typing it in twice, or looking at the bracelet and typing it in twice, because this is one of the best ways to catch errors. This is important because it's the last chance to possibly catch a fatal error before the blood product is administered to the patient. Because as soon as this is done, what you're doing is you're hooking up the blood product to the patient, and at that point it's too late to stop an error, so it needs to be done before that. So the TAR helps with assessing vital signs. The TAR is where the nurse charts vital signs before, during, and after blood product administration for easy comparison of them. So you're not looking at the wrong vital signs. You have the right vital signs. They're easy to graph there. It's a great program. So the TAR also prompts the RN when to conduct the repeat vital signs, which is very important when monitoring for a transfusion reaction. Non-invasive monitoring of patients' pulse, blood pressure, temperature, and respiratory rate has been used to ensure any reaction is noticed and acted on by staff. So that's why getting these vital signs at the right time is so important. And so symptoms of serious transfusion reactions frequently appear within 15 minutes after the blood enters the vein. Therefore, observation of the patient during this time period is of utmost importance. And this is why it is such a great thing that the TAR prompts us to assess the patients at this time, because you don't want to miss that 15-minute time frame. That's, as I said, it's the serious ones frequently appear within 15 minutes, so we want to make sure we're catching those. The TAR gives us a cheat sheet to help with the RN assess for transfusion reactions. So it allows the nurse to catch on to the transfusion reactions quickly, which is important because we need to stop the blood from going into the patient at that point, and then continue with usually normal saline. Diagnosis of acute transfusion reactions begin by recognition of the signs and symptoms by the bedside. So that's the only way we're going to know if they're having an acute transfusion reaction, is if we're watching their signs and symptoms at their bedside. When transfusion reaction is suspected, the transfusion should be immediately stopped and the intravenous line should be kept open using appropriate fluids, which is normally normal saline, as we talked about. Understanding how to quickly identify the transfusion reactions and appropriately manage and treat the patients ensures optimal patient care, which is why it's so nice that we have this cheat sheet for us to make sure we're not missing anything, because there are a lot of transfusion reactions we have to watch for and a lot of signs and symptoms. And it's just so nice to have a nice list there that tells us, what we're looking for. And blood transfusions are often necessary in medicine, and healthcare workers have to be familiar with the transfusion reactions. As I said, it's so nice because there's so many different transfusion reactions that we need to know what we're looking for before we have that, before that happens. So in conclusion, the TAR is one of the most important tools in enhancing patient safety. So, we have to be sure we are putting in the correct, person, the correct blood product time, just like medications. There's the 6 rights. We have those are very important to follow with the TAR as well. And the TAR ensures proper matching of the correct blood product to the correct patient and the doctor's order, which is so important because this is one of the major issues with blood product administration. We don't want to be giving blood to the wrong patient or the wrong blood product to the wrong patient, to the right patient. And then, of course, everything goes by a doctor's order when you're a registered nurse. So you want to make sure all that stuff matches, and it's very important because if it doesn't, then you could potentially kill somebody with that. So, definitely make sure that everything's matching. The TAR helps the nurse track vital signs quickly, determine if a patient is having a transfusion reaction, and respond to that reaction. So that's also very important. As I said, the vital signs need to be taken at the right time, and it's so nice that they prompt us to take them at that specific time because, as mentioned earlier, 15 minutes after the start of the transfusion is usually when you're going to start seeing something. It's going to be a serious acute reaction, and you want to be sure that you are catching that and stopping the blood product, running normal saline, and definitely notifying the physician of what happened and keeping an eye on that patient. So that's very, very, very important that we do that. And then it's just one of the many examples why informatics is so important, which it is so important in our field. Without informatics, we could have so many errors with medicine, so many errors with vital signs, just basic things. Like, we use informatics so much more than you would ever even imagine we do. But this is just one of the ways that informatics is so, 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 so important to our field. Because before we had the TAR, as it said, like, most of the transfusion errors were caused by human error. So it's so, so, so important that we use this TAR to get rid of those problems with human error. I mean, and they don't get rid of all of the human error, but they help significantly. And even, as discussed in the barcoding earlier, there was, they tried putting just a label on the blood bag to have us check the wristband. And, I mean, even that didn't totally fix the human error. Like, barcoding has been the only thing that has really, really significantly helped with the human error as far as matching the patient wristband to the patient blood bag. So it's very important that we have informatics and nursing. So this is my first set of references. Just let you have a moment to take a look at those. I got a lot of my references from NCBI. And then here's my last two references, just so you get a chance to take a look at those. And again, I got a lot of my references from NCBI. You can find all kinds of information about transfusion reactions and human error and everything there. So if you wanted more information, there's some great articles to check out, along with, just articles on barcoding, everything you wanted to read about. It's a great place to check out. So that is all I have for you today. Thank you so much for watching. Hope you enjoyed my video on the TAR and why the TAR is important in nursing informatics. Thank you so much.